Welcome to our article summary for neurocognitive disorders, traumatic brain injury due to concussions. So for this article, I chose to read and summarize the article Long-Term Consequences of Traumatic Brain Injury. Current status of potential mechanisms of injury and neurological outcomes. This article was very informative about the long-term effects of traumatic brain injury. So traumatic brain injury is usually from some type of head trauma. Many people would know as like football, NFL players get traumatic brain injuries when they undergo severe injuries, hits, anything that causes trauma to the head. So a car accident, any type of accident, anything where you're injuring certain parts of your brain. So a traumatic brain injury is a significant clinical problem in this country with few therapeutic interventions. So although a lot of people undergo concussions, there isn't much that's understood about how to treat these types of injuries and how to deal with the long-term effects of these injuries. So there's a need to better understand the chronic consequences of traumatic brain injuries to develop proper therapeutic interventions for that specific injury. So sustained injuries that happen repeatedly, so like this would be a good example of an athlete or a football player, can also lead to prolonged motor and cognitive issues. So people who undergo multiple head injuries are more likely to develop brain and neurological problems. People with traumatic brain injury have an increased likelihood to develop neurodegenerative diseases with long-term consequences of TBI, including excitotoxicity, apoptosis, inflammatory events, seizures, demyelination, white matter pathology, and decreased neurogenesis. So the more we understand about TBI, the more we can see that significant trauma to regions of the brain causes a decrease in neural functioning. So again, traumatic brain injuries create short and long-term chronic consequences, which can lead to permanent disabilities that increase mortality rates. Single or repetitive TBIs can result in multiple secondary pathological conditions such as seizures, sleep disorders, neurodegenerative diseases, neuroendocrine dysregulation, and psychiatric problems. Symptoms from TBI can persist for months or years after injury and significantly affect the quality of life. So really, when we're talking about TBIs and we're talking about long-term consequences, we're talking about serious diseases such as Alzheimer's, Parkinson's, and other diseases that significantly affect how one functions and their quality of life. So the study also discussed how MRI imaging shows the brain damage from TBIs and how the damage in the brain causes reduced blood flow throughout the brain tissue, which alters behavior. So reduced blood flow to the brain can aggravate inflammatory or excitotoxic processes in the body, which can cause other diseases mentioned in the previous slides. In addition to that, traumatic brain injury, of what we know so far and what was shown in the study, again, can increase one's likelihood of developing age-related neurodegenerative diseases such as Alzheimer's and Parkinson's. So what this study is saying, somebody who experiences a TBI is more likely to develop brain issues later in life, such as issues as Alzheimer's and Parkinson's, which affect your neurocognitive and motorized functioning. So what this article did an amazing job at highlighting all of the different facts and things that are important. And one of the things I found the most in my research was that there is a lot of interventions that lack to help people who suffer from Alzheimer's, Parkinson's, and other issues caused by TBIs. So in all of the research that I had accomplished, the one thing that I found the most congruent between everything was the lack of concrete interventions to heal and treat issues such as Alzheimer's, Parkinson's, and other issues caused by traumatic brain injuries and concussions. Thank you so much for watching my presentation.